It's going to be limited, because that's what phase one is, and it's going to be with lots of clear standards.
The road back, the new timeline for the city to get back on its feet. The spread of a dangerous COVID-linked syndrome in children. A look inside New Jersey hospitals where doctors say the sick kids keep arriving. And keeping faith forward, from rooftop sermons to outdoor confessions, the innovative ways of serving the faithful in a pandemic. Good evening, I'm Chuck Scarborough. Natalie's off tonight, and we start with positive news on the road to reopening here in our area. Statewide, 7 of 10 regions have reopened. New York City and Long Island have met 4 of the 7 metrics outlined by Governor Cuomo. The Mid-Hudson region, 5 metrics. Good progress, but the hospital bed capacity and shortage of contact tracers and the death rate are still holding our area back. So how soon could the city solve those problems and begin to reopen? Mayor de Blasio said that indicators show that it could be anywhere from June 1st to June 15th. Better news for beachgoers downstate. Beaches open tomorrow morning with one catch. They'll be limited to 50% capacity. And the governor expects that capacity to be reached by 10 a.m. And News 4's Andrew Siff is live in Jamaica, Queens right now with the latest on this. And Andrew, I guess the early bird gets the blanket.
Right. Certainly when it comes to the parking lots at state beaches on Long Island, the governor is saying maybe 10 a.m., 11 a.m., it'll already be full. You'll have to turn around. And then when it comes to taking trains and buses, the message from the MTA is don't do it. Just look how empty it is at what used to be rush hour pre-pandemic. Well, now in this new reality, the MTA is worried about a surge this holiday weekend. They're saying don't take the train. The LIRR train to Long Beach is normally packed this time of year. This holiday weekend, the railroad's message is,
you do not need to ride with us unless it's an essential trip.
Similar advice from the man in charge of buses.
Part of keeping everyone safe for now is staying off the buses. So please do not try to take them to the beach this weekend.
The warning, because city beaches are closed to swimming, but open for sunbathing. The NYPD late today.
You can go in ankle deep, wade in the water. Surfers will be allowed into the water, but will not be allowed to swim.
The governor was asked about New Yorkers heading to state beaches on Long Island instead. His advice, leave early.
I'm a Queens boy. It's a ride to these beaches. And you don't want to take that ride and get all the way out there and find out the beach is already closed.
The concern, crowded trains where social distancing is impossible. More than 120 transit workers have died in the COVID crisis.
We need hazard pay. We demand hazard pay. Transit workers and all MTA workers deserve it.
And those workers may soon see subways less empty than what's become hauntingly normal in the pandemic. A partial reopening of the city could be only 2 weeks away.
First week or second week of June, if we continue on the pace we are on now.
The mayor today doubled the number of Staten Island ferries at rush hour after an uptick in passengers already. Are you concerned that essentially people are lifting the lockdown themselves?
I think what's happening is that folks are naturally, growing into what is allowed, and that even many things that were allowed, people were not doing.
Ridership on the ferry had been down 90%, so even the small uptick was noticeable. Ridership also down 90% across Long Island Railroad and the subway system, and the MTA hoping it doesn't surge this weekend. We're live in Jamaica. Andrew Siff, News 4 New York.
Well, just the tip of the iceberg. Those words from Governor Cuomo as cases of a potentially deadly COVID-linked syndrome spread across New York, the tri-state, and the country. Half the U.S. is now reporting cases after the I-Team first broke news of this illness. 157 in New York State, most here in the city, 19 in New Jersey. News 4's government affairs reporter Melissa Russo is live in the newsroom. And Melissa, Governor Cuomo credited your hard work on this story that you first broke. What'd you learn today?
Thanks, Chuck. He did. And the governor also said that the more we look for these cases, the more cases of sick children we find. But the critical care pediatricians throughout our area, they're telling us they don't have to go looking for any of these cases because the children are literally flooding into their emergency departments. In ordinary times, it would be unheard of for a pediatric cardiologist like Dr. Rajiv Verma to be this inundated with children in heart failure and shock.
We've seen at least 12 patients in the last 10 days.
But here at Newark Beth Israel Hospital, the sick children keep on coming.
We are still getting admissions, including last night and this morning. We are all desperately hoping it slows down soon.
Well, it was like somebody was stabbing my foot over and over again.
One of Dr. Verma's patients was 12-year-old Giselle Rosario, who went into heart failure after developing a blood clot. Like most of these children, she tested positive for COVID antibodies.
I almost died.
I have talked to at least 2 teenagers who are scared that they're going to die. I don't lie to them. I tell them this is a very serious illness, but we'll do our best to keep them alive.
Dr. Verma says if he's had 12 cases just at his hospital, it's hard to imagine the entire state of New Jersey only has 19 cases.
There's a total of 19 cases.
But that's the new total Governor Murphy and his team announced today. In New York, the number of cases is up to 157.
COVID-related child illness. Ms. Russo's done great work on this.
Governor Cuomo today praised our work in the News 4 I-Team. We were first to uncover the pattern of these cases in local children. Now it's happening worldwide.
Today, there are 13 countries and 25 states.
Leaving summer plans painfully on hold.
I would not send my children to day camp.
Today, the city lowered its count of children suffering from the illness from 158 down to 89 to keep the city's list consistent with new national criteria, which require a positive test for COVID or the antibodies or a known exposure to COVID within 4 weeks of getting symptoms. 43 of the city's cases are still under investigation.
Younger children, they're obviously scared, they're sick, they are being poked and prodded.
Dr. Verma says while the experience can be traumatic, most children, if treated quickly, recover fully.
And, like there's a teenager who came in on Sunday who was critically ill, and today she's actually smiling.
And of course, that's really great to hear. Thankfully, most of these children do improve pretty quickly, though Dr. Verma says 2 of his 10 patients who he has right now in his care have a longer road ahead, at least another 2 or 3 weeks in the hospital. Chuck?
All right, Melissa, thank you very much. New Jersey's largest city plans to start reopening sometime next month. Mayor Ross Baraka of Newark says that the plan is broken into 4 phases, each separated by at least 2 weeks. And after the reopening begins, Baraka says that masks will be strongly recommended because there will still be a risk of getting sick.
Avoid touching your face, close contact with others, washing your hands frequently, soap and water or hand sanitizer as well.
Governor Murphy also said today that key indicators such as the number of cases and deaths keep dropping overall statewide. The coronavirus infection rate in Connecticut is now just 3% as the state enters day 2 of its reopening plan. Governor Ned Lamont held a news conference at Gay City State Park today, spelling out the changes you'll notice this summer at state-run beaches and parks. They include social distancing, wearing masks, of course, and keeping blankets 15 feet apart.
And to me, I really wanted people to keep their social distance, but I also appreciated what an amazing setting like Gay City State Park can do to people's not just physical well-being, but mental health and dealing with some of the stress that's here.
The governor encouraged residents to explore less traveled parks, adding that if any park reaches capacity, it's going to be closed to additional visitors for the day. A church in Connecticut is showing what could be the future of worship during a pandemic. St. James Parish in Stratford held its first Mass. The altar set up on the roof, parishioners in their cars, communion given by priests in face masks. Now, this comes as the Archdiocese of New York released details of its plan to keep almost 3 million faithfuls safe. This one, Rana Novini, is outside St. Patrick's Cathedral right now with the Faith Forward initiative. Rana?
Well, Chuck, under the governor's new order for religious services, only up to 10 people are allowed to gather at any given time. So for the Catholic Church, they're focusing first on private prayer and confessions with the goal of eventually moving towards something of a traditional Mass once local laws allow.
We will have Mass here if somebody doesn't come with a mask.
Faith and face masks for the New York Archdiocese 2.8 million Catholics. The church set to resume some services, confession outdoors when possible, tape markings in the pew to mark a safe distance, no choirs in the loft, no holy water or holy books to handle.
When we do get back, everybody, our people are going to find some things are different.
Cardinal Timothy Dolan laid out guidelines for parishes as they foresee a return to worship. The first focus, private prayer. Then small, socially distanced groups for baptisms, marriages, and funerals. A traditional Sunday Mass at a quarter capacity is likely weeks away.
We're not like the regions in the upper part of the state. They didn't have the same effect that we did of the coronavirus, so we have to be careful in what we do.
In this moment, we all need to have faith.
Marzia Bartolini expected St. Patrick's Cathedral to already be open, but reopening will be slow, and it will differ between houses of worship.
So let's begin with the Nigun, the melody without words.
Sutton Place Synagogue has moved its services virtual since March. The rabbi says even with new guidelines, they're looking at online services for many more months to come.
Even if there's a small core number of people in the sanctuary, we're going to create a meaningful experience that's done virtually for all to watch on live stream to participate in the holiest days of the Jewish year.
The governor is also asking places of worship to consider having drive-up or parking lot services where possible. Reporting live in Midtown, Brianna Novini, News 4, New York.
Brianna,